BTS News Today. The shocking news came from Jungkook, a BTS member known for his stamina and energy on stage. Rumors circulated that Jungkook underwent lumbar radio frequency nerve ablation, RFA, to treat facet joint arthritis, a medical procedure used to relieve chronic pain in the lower back. However, is it true that Jungkook underwent this procedure? Jungkook injured his shoulder while shooting for Calvin Klein. He fell because of the slippery floor, which caused his shoulder to hurt and his finger could not be moved. However, he confirmed that his condition has improved and he is recovering from the injury. In addition, during a trip to the US, he admitted that his health had deteriorated. Fans noted that she performed in rainy conditions and looked unwell. What is lumbar radio frequency nerve ablation, RFA? RFA is a medical procedure that uses radio waves to heat and deactivate the nerves that transmit pain signals from the facet joint. This procedure is usually performed for patients who experience chronic pain due to arthritis or other spinal problems. If Jungkook did undergo this procedure, it means that he is likely to experience significant lower back pain due to facet joint arthritis. However, to date, there is no official confirmation from agencies or reliable sources about this. Jungkook, the youngest member of the phenomenal group BTS, is known as one of the idols with incredible stamina on stage. However, shocking news emerged regarding his health condition. Rumors circulated that Jungkook underwent lumbar radio frequency nerve ablation, RFA, to treat facet joint arthritis, which is a medical procedure performed to relieve chronic pain in the lower back. Jungkook is known to have a strong physique and is diligent in exercising, but that doesn't mean he is immune from injury. In recent years, he has experienced several incidents that could potentially affect his health. In 2023, Jungkook suffered a shoulder injury while filming a Calvin Klein campaign. He fell while running on a slippery floor, which resulted in pain in his shoulder and difficulty moving his fingers. Although he assures that his condition is improving, this kind of injury can have long-term effects, especially for a performer who often performs intense movements on stage. When Jungkook arrived in the US for some scheduled activities, he revealed that his health had deteriorated after landing. Fans who noticed her at the concert said that she looked sick and had to perform in rainy conditions. Although there are no official reports that mention the connection with nerve problems or arthritis, this condition can be a factor that causes him to need to undergo further medical procedures. If the rumors about Jungkook undergoing radiofrequency lumbar nerve ablation, RFA, are true, then he may be experiencing chronic pain in his lower back that is quite serious. Here is an explanation of this procedure. Definition of RFA is a medical procedure that uses radio waves to heat and deactivate the nerves responsible for sending pain signals. This procedure is often used to treat chronic pain caused by facet joint arthritis, that is, an inflammatory condition of the small joints in the spine. How is RFA done? The patient is given a local anesthetic to reduce pain during the procedure. Electrode needles are inserted into the diseased area of the spine using X-ray guidance. Radio waves are passed through the electrodes, heating the nerves responsible for the pain. The nerve is deactivated, so it no longer sends pain signals to the brain. This procedure is relatively minimally invasive and can provide pain relief for several months to years, depending on the patient's body response. Why might Jungkook need an RFA? If Jungkook does undergo RFA, there are several possible reasons underlying this decision. Intense physical activity. As a performer, Jungkook often performs heavy choreographed movements, including high jumps, acrobatic dances, and heavy physical exercises. This can put enormous pressure on his spine, potentially leading to facet joint injuries. Old injuries that are getting worse with age. Old injuries that were previously considered minor can develop into chronic problems. If Jungkook has persistent low back pain, RFA can be a solution to manage his pain without having to undergo major surgery. Avoiding long-term drug use. Some chronic pain patients often rely on anti-inflammatory drugs or other pain relievers. However, for an idol like Jungkook, long-term use of drugs can have an impact on his stamina and overall health. Therefore, a procedure such as RFA may well be chosen as a safer and more effective solution. Impact on Jungkook and BTS career. If Jungkook does undergo RFA, this could impact several aspects of his career. Adjustments in choreography. BTS is known for their intense choreography. If Jungkook needs to reduce certain movements, there will likely be adjustments in their stage performances. temporary rest from heavy physical exertion. Although RFA is a procedure that does not require long recovery, Jungkook may still need to reduce strenuous physical activity for some time for his body to adapt. Support from fans and agencies. Army, a BTS fan, always gives full support to the health of its members. Big Hit Music is also likely to ensure that Jungkook gets the best treatment possible and enough rest time before returning to full activity. Comparison with similar cases in the entertainment world. Jungkook isn't the only celebrity to have chronic pain issues and undergo medical procedures to overcome them. Some examples of similar cases in the entertainment world include Lady Gaga had fibromyalgia, a chronic pain condition that affected her body to the point of having to cancel tours. Selena Gomez has lupus, which causes joint pain and extreme fatigue. Justin Bieber suffers from Ramsay-Hunt syndrome, which made it difficult for him to perform on stage. These cases show that the health of an artist is very important and should be a top priority, even if it means they have to reduce their activity. Schedule. Although there has been no official confirmation about Jungkook undergoing lumbar radiofrequency nerve ablation (RFA), this speculation reminds us of the importance of the physical health of K-pop idols. With busy schedules and high-performance demands, injury or chronic pain can be a real risk. Most importantly, as fans, we must always support Jungkook and ensure that his health remains a top priority. If there is an official announcement from Big Hit Music, be sure to get information from reliable sources. Army, let's continue to wish Jungkook health and happiness. Although the news of Jungkook undergoing RFA has yet to be confirmed, fans remain concerned about his health. With a busy schedule and intense physical activity, it is not surprising that he experiences certain health problems. Impact of back pain on performers and athletes. Back pain, especially as a result of facet joint arthritis, is one of the conditions often experienced by dancers, athletes, and performers. This profession requires them to perform repetitive, explosive movements and often in unnatural positions, which can accelerate joint wear. Some factors that increase the risk of back pain for performers like Jungkook: intense movements and complex choreography. Jumping, spinning, and acrobatic dance moves stress the spine. Overtraining. BTS is known to have a very busy training schedule, which can lead to chronic tension. Lack of recovery time. Tiring tour schedules can hinder the recovery of minor injuries, making them worse. Psychological impact. Stress due to high expectations can worsen the perception of pain and recovery of the body. Professional athletes often encounter a similar problem. Cristiano Ronaldo and LeBron James are known to undergo regenerative treatments to maintain their performance at an older age. If Jungkook does have chronic back pain, choosing RFA as a solution is a sensible medical move. Technology and innovation in the treatment of injuries in the entertainment world. Modern medical technology is increasingly developing to help performers stay in top shape. Some of the possible methods used by Jungkook or other artists for recovery include